The role of a phlebotomist is both technical and interpersonal. It requires precision in drawing blood and professionalism in interacting with patients who may be anxious or fearful. During an interview, employers assess not only your clinical skills, but also your empathy, communication, and adherence to safety protocols. Whether you're applying at a hospital, laboratory, or clinic, preparation is key to showing that you can perform the job efficiently and compassionately. This guide covers common phlebotomist interview questions, along with sample answers and practical tips. By understanding the employer's expectations, you can confidently demonstrate your abilities and dedication to patient care. Understanding the role of a phlebotomist. A phlebotomist is responsible for drawing blood for medical tests, transfusions, donations, or research. This role involves preparing patients, ensuring accurate labeling of samples, maintaining sterile equipment, and following safety and infection control procedures. Beyond technical ability, a successful phlebotomist must show patience, professionalism, and strong communication skills to make the experience comfortable for every patient. Employers value candidates who are detail-oriented, organized, and calm under pressure. Efficiency, compassion, and accuracy define the qualities that make a phlebotomist stand out in this healthcare profession. Question 1. Can you tell us about your experience in phlebotomy? Here's how you can answer. I have worked as a phlebotomist for X years, drawing blood from patients of all age groups. My experience includes preparing collection equipment, verifying patient identity, labeling specimens accurately, and maintaining a clean workspace. I've also worked with patients who were nervous about needles and used communication and reassurance to keep them calm. Tip: highlight the number of patients you handle daily or your familiarity with different blood collection methods if possible. Question 2. How do you make patients feel comfortable during a blood draw? Here's how you can answer. I start by explaining the procedure clearly and maintaining a calm, friendly tone. If the patient is nervous, I encourage slow breathing and keep them distracted with light conversation. I also make sure my technique is smooth and efficient to minimize discomfort. Tip: emphasize empathy, patience, and communication, key interpersonal qualities employers look for. Question 3. What steps do you take to ensure proper identification and labeling of samples? Here's how you can answer. I follow strict protocols by verifying the patient's identity using at least 2 identifiers, such as name and date of birth. After drawing the sample, I label it immediately in front of the patient with the correct details to prevent mix-ups. Accuracy at this stage is essential to maintain test integrity. Tip: show your awareness of how small errors can affect diagnostic results. Employers appreciate precision. Question 4. How do you handle a patient who is afraid of needles or faints during a draw? Here's how you can answer. If a patient is fearful, I stay calm, reassure them, and give them time to relax. For those prone to fainting, I ensure they are seated or lying down, and I monitor their condition throughout. If fainting occurs, I follow safety procedures, lowering the patient's head, calling for medical assistance if needed, and documenting the incident. Tip: employers value candidates who stay composed and prioritize patient safety in stressful situations. Question 5. How do you maintain infection control and safety in your work area? Here's how you can answer. I always wear appropriate personal protective equipment, use sterile needles, and dispose of sharps immediately after use in designated containers. I disinfect surfaces regularly and wash my hands before and after each procedure. Following OSHA and CDC guidelines ensures both patient and staff safety. Tip: mention your familiarity with safety protocols and your commitment to maintaining hygiene standards. Question 6. What do you do if you can't locate a suitable vein? Here's how you can answer. I stay calm and avoid repeated unnecessary attempts. I assess both arms, apply a warm compress if needed, and use proper lighting to identify veins. If I'm still unable to find a vein after 2 attempts, I seek assistance from another qualified professional to ensure patient comfort and safety. Tip: show professionalism and patient respect. Never force a procedure. Employers prefer phlebotomists who prioritize patient care over speed. Question 7. How do you manage multiple patients or high workloads? Here's how you can answer. I plan ahead by organizing supplies and labeling materials in advance. I work efficiently without rushing and maintain a steady pace to avoid errors. Clear communication with the team helps manage workflow during peak hours, ensuring that every patient is handled with care. Tip: employers seek phlebotomists who balance speed and accuracy effectively under pressure. Question 8. Can you explain how you handle biohazardous waste? Here's how you can answer. I strictly follow biohazard waste disposal procedures. All used needles, tubes, and contaminated materials are disposed of in clearly marked biohazard containers. I never recap needles and ensure all materials are sealed and stored safely before transport or disposal. Tip: mention compliance with safety regulations and institutional policies to show reliability. Question 9. What should be done if a sample is mislabeled or lost? Here's how you can answer. If a sample is mislabeled or missing, I immediately report the issue to my supervisor, discard any questionable samples, and recollect the specimen following the proper procedure. I also document the incident to prevent recurrence. Maintaining accuracy in specimen handling is a top priority. Tip: demonstrate integrity and accountability, traits that reflect professionalism in healthcare. Question 10. How do you handle difficult patients or those who refuse to cooperate? Here's how you can answer. I remain calm, listen to their concerns, and try to address their fears respectfully. If they continue to refuse, I document the refusal and inform the nurse or physician in charge. It's important to respect patient rights while ensuring safety and communication. Tip: show emotional intelligence and respect for patient autonomy. Question 11. What qualities make a good phlebotomist? Here's how you can answer. A good phlebotomist must have precision, patience, and compassion. They should handle specimens carefully, communicate clearly with patients, and maintain strict hygiene and safety standards. Attention to detail and a caring approach ensure both accuracy and patient trust. Tip: emphasize a balance of technical skill and empathy in your response. Question 12. Why should we hire you as our phlebotomist? Here's how you can answer. You should hire me because I combine technical expertise with a patient-focused approach. I have strong attention to detail, excellent communication skills, and a deep understanding of safety and infection control. My goal is to ensure every patient feels cared for and every sample is collected with accuracy and professionalism. Tip: summarize your strengths and commitment to providing quality service. Preparing for a phlebotomist interview. Before attending the interview, review basic venipuncture techniques, blood collection order, and specimen handling procedures. Be ready to discuss your training, certifications, and experience with various patient groups. Some employers might ask you to demonstrate your technique or describe specific scenarios, such as dealing with pediatric or elderly patients. Dress professionally, arrive early, and carry any certification documents or references. If you're a recent graduate, highlight your clinical training and eagerness to learn. Practicing common interview questions in advance will help you stay confident and composed during the interview. Final thoughts. A phlebotomist's job involves much more than drawing blood. It's about making patients feel safe and respected while maintaining accuracy and efficiency. Employers seek individuals who combine technical skill with compassion and clear communication. By preparing thoughtful answers and showing confidence in your expertise, you can make a strong impression. Approach your interview with professionalism, empathy, and attention to detail, and you'll demonstrate that you have the qualities needed to excel as a trusted phlebotomist.